just dropping by while I was editing this video because I have an announcement. Before we continue with this video, I wanted you guys to stop what you're doing and click the link down below. If you are a nurse, or if you work in a healthcare facility, if you're a nurse's aide, if you're a tech, if you work within the healthcare, I want you to click the link down below and just answer the survey. It takes less than a minute to complete, and it's just asking you guys about how to prevent readmissions into the hospital for patients and how to maintain them at home. So if you have any ideas or any input, this is your time, and this is your time to put your input down below, and just click on the link and make sure when you get down to who referred you, make sure that you click my name. But I just want you guys to click down on the link and answer the survey for me. So, yeah. Good morning. It is Tuesday. So today's video is going to be a day in my life as a nursing student. So I already took my exam this morning, and it was on endocrine. Did pretty well. It was so sweet. So now I'm gonna go to I'm supposed to be listening to my lecture, but I'm gonna go to my job because we have to get tested for COVID. So yeah, we have to get tested for COVID basically because just to make sure that we don't have it. Because if you guys didn't know, I work in a nursing home as a nurse. So yeah, I'm just heating up some breakfast right now, and then I'm going. But when I get home, I'm probably gonna work on my clinical paperwork that I gotta do, and also I gotta work on what else I gotta work on. Oh, I gotta listen to my lectures, my 7 lectures, because I have another test on Monday, and then I want to try to edit some YouTube videos because I feel like school takes up 99% of my day, but I want to get some content out. So yeah. So here I'm just showing you the patient information for our virtual clinicals. Usually we'll just have to go an overview. It's like a report, say you was to come on shift, like an S-bar. Then here is the pre-quiz that we have to take, to make sure that we know what we're going into, and just to have a little bit of knowledge of what we're learning, that thing. And there's a little bit of knowledge about our patient too. Then here is the actual simulation. So this is my patient, and as you can see, it's a maternity patient. Basically she's in active labor. I think this one has the shoulder dystocia, I think, but it's just loading, and usually you just have to wait for that. So as the chart loads up, it shows you patient information, which again shows you everything about the patient. Then it shows you patient log, diagnostic testing, clinical observations, medication charts and orders. And then those that are blinking, it's basically telling you that there's information in there to be reviewed for that particular case. So I'm just scrolling and reading patient log. Their labs. They got labs done, or a MRI or a CT. And this is the orders. So it tells you what needs to be done for that patient today. And the call orders, when you need to call the provider. Just things that you need to keep in mind. Okay, so moving on, this is our scenario. You see our patient, and then you see the nurse, and then that's like the family member, and then right here is things that we need to do before we start. And basically, that's just how the computer grades us. You have to wash your hands, identify the patient, introduce yourself, ask about any allergies. I'm just clicking through to show you guys. As you can see, she's in active labor. And then below, you have like communication, basically to call the doctor, to call NICU, to call surgery. And then we have assessments, because we have to do a head to toe assessment. We can listen to heartbeat, listen to the lungs, check for edema, listen to pedal pulses. Feel for pedal pulses. We could like check their blood pressure, check their respiration rate, check their IV, assess their IV, and just you can do a lot of things. Different scenarios. You could do different things, and then yeah, you can ask them for pain. And the interventions, we could like put oxygen. We could elevate the head of the bed. We could. It's just a lot of things that we could do. So I'm just gonna let the rest of this play and have you guys take a look at it and just see what you guys think. It's not a lot of it's not much. It's just I guess a little game for us to play. But you do learn some things. I think you learn some things sometimes. get so much things to do. It's ridiculous. I'm tired. Anyways, alright guys, so this is a new day. The previous videos is just showing you guys what we do every week with this online school. And some people would say that it's easy, but to me, I think it's just like a little bit more tedious work. I currently am sitting on a lot of things to do this week, and every week I struggle to get them done, but hey, I try. So today's agenda is like I have a lot of quizzes to get done. I have to do my case study. I have to do like other things. It's just like a lot of stuff. We completed our maternity clinicals last week, so that's good that I don't have to worry about that for tomorrow. And then I also have to study for my test on Monday, which is liver and obesity. So yeah, I want to say thank you guys so much for watching this video. I may not be consistent as I want to. However, school has just been taking up most of my time. And also I've been trying to work 2 days a week as a nurse to maintain my skills and to learn and to gain experience. So yeah, I'll see you guys in my next video. Bye. Don't forget, if you didn't take the survey earlier, please click the link down below and take the survey. See you guys in the next one. Bye.